I'm Chad. I'll be the doctor.
Hi, I'm Carlos. I'm going to be the NICU nurse.
Hi, I'm Nate, and I'll be a nurse.
I'm Diana, and I'm going to be the nurse.
I'm Mai, and I'm going to be a nurse.
I'm Julia, and I am a nurse.
I'm Parisha, and I'm going to be the dad, boyfriend.
I'm Luciana, and I'm going to be the mom.
Hi, I'm Marianne, and I'm Luciana's mom.
I'm Jordan, and I'm going to be a nurse.
My name is Mai. I'm going to be a triage nurse today. So what brings you guys in?
We're here because we were at the store, and I felt like a gush of water in between my legs, and I've been feeling a lot of pressure, cramping, some pain.
Okay. And how far along are you?
How far along am I? I don't even know.
31 weeks.
Do you have any prenatal care?
What's that?
Are you seeing a doctor?
Oh, no.
No?
Mm.
Are you taking any medications?
No.
Do you do drugs?
No.
Drink? Alcohol?
Sometimes.
What about smoking?
1 or 2. Sometimes.
You smoke every day.
No, I don't. Don't lie.
Okay, well, we're going to perform a nitrogen test to see if your water really broke. And then we're also going to do some fetal monitoring to make sure your baby's okay.
Maria, my name is Jordan. I'm going to be your nurse today. So we did a nitrazine paper test. That was positive, so your water did break. So now we're just going to monitor your contractions and the fetal heart rate to make sure baby's okay. All right? Any questions?
And why are you going to do that?
Just to make sure the baby's doing okay and mom's doing okay. And
Okay, because she's only 17 and she hasn't really taken very good care of herself.
okay, well, we'll see if everything is looking good.
Hi, Maria. My name's Dr. Dilation. I'm going to be your doctor today.
Hi, Doctor.
I guess it looks like you don't have any prenatal care, so it's a little concerning. The nurse said you were dilated to 3 centimeters and that there was your water broke, so you are definitely in preterm labor, and then with the contractions being 5 minutes apart, it's a little concerning, but we're going to see what we can do to take care of you today. So I'm going to have a nurse come in, and they're going to start an IV on you, and we're going to give you a few medications. So we're going to give you some betamethasone, some magnesium sulfate, and also some ampicillin. So if you have any questions about that stuff, you'll be able to ask
Am
the
I
nurse.
having my baby today?
No, we're gonna try and delay that for a day or 2. So the nurse is gonna give you a little more information on that. Okay.
Okay.
All right. Anything else you need? All right. Thanks, guys.
So the doctor came in, he said that she's on preterm labor, and she's going to give her some meds.
Yeah, I was just talking to a nurse out there, and she was telling me the risks of preterm labor. She says someone between the ages 17 and 35, and you fit right in that, honey. You're 17 years old. Another one is, I heard that you've been smoking. Has she been smoking?
No, I haven't.
She has.
Oh, gosh. I thought I taught you
Tell
better.
her the truth.
Okay, well, that's a risk too, is if you're smoking,
Sorry.
lack of, and you haven't seen your doctor. I know we don't have any money, but we should have gone in and seen the doctor.
I don't like seeing doctors.
Well, I know, but we need prenatal care, otherwise that is another risk for having a baby early. I'm gonna give you the risk for preterm labor. It is ages below 17 or ages above 35, of low economic status, the use of smoking, the use of alcohol, lack of prenatal care, low pre-pregnancy weight, preterm, premature rupture of membranes, infections in the uterus, previous preterm births, the use of substance abuse, history of multiple miscarriages or abortions, recurrent premature dilation of cervix, bleeding in the second trimester. These are all risks associated with preterm labor.
So are there any side effects, or is the baby going to be okay after you give the medication?
Yeah, actually that's what the betamethasone is for, to make sure that your baby is okay when he's born. It's going to make sure that his lungs are mature and he's got this stuff called surfactant. So that'll make sure he's able to breathe as soon as he's born, because sometimes lungs can be a little bit underdeveloped in premature babies. There are going to be some side effects for you maybe. With the magnesium sulfate, that's a smooth muscle relaxer. So you want to be careful when you're changing positions. If you're going to get up, go ahead and press that call light and we'll help you, because you might get a little lightheaded. You also want to let me know if you've got any blurred vision, headache, any nausea, or if you end up vomiting, or any difficulty breathing. So yeah, any other questions?
That's it. Thank you.
Hi, sorry, did I scare you?
No.
No, okay, well, I just want to talk to you about, you know, the requirements you need to stay here and what you need to do right now. For right now, you're gonna, I don't know if they talked to you about it, calling us before you use the restroom, just in case. Have they talked to you about that? Yes, okay, all right then. Well, I want you to
Can
stay.
you explain why?
Okay, the reason why is because you're taking this medication, it's called magnesium sulfate. We don't want you to get dizzy and then fall. Okay, another thing that you wanna avoid is, you know, don't have any sexual intercourse at this point. Okay, I know that. I know. That's okay. Okay, plus you're at the hospital, right? Okay. Well, also, I want to talk to you about staying on your left lateral side. Okay, you want to stay on your left lateral side to increase blood flow to uterus. Okay, and also make sure you're drinking a lot of water. Okay.
So Maria, I'm a little concerned about baby's heart rate, so we're gonna lay you on your left lateral side, okay? Go ahead and turn. The reason we want this mom on her left lateral side is because she was having late decelerations. A cause of late decels are uteroplacental insufficiency, which causes inadequate fetal oxygenation. Having her lay on her left side will increase blood flow to the placenta.
Hello, Dr. Dilation. This is Mai from OB at COS Hospital, calling to update you about Maria in room 2. Maria presented to the OB triage at 4. She is a 17-year-old prima gravida. Her rupture membrane was at 3:30 on May 1st. She is GBS positive, RH positive, rubella immune, hepatitis status unknown, and she has no allergies. She has been on magnesium sulfate, ampicillin, and betamethasone. Maria has been on the fetal monitor for the past 48 hours, and fetal heart rate has decelled to the 70s. She's dilated at 3 centimeters. Her blood pressure is 130/68, pulse 100, respiration 24, and her temp is at 98.9. We need you to come in and check on her.
Hi, Maria. So the nurse called me, and we're concerned about baby's heart rate. You know, I think we've kind of held this off as long as we can, and I think we're going to have to take you in and go ahead and do a C-section. I know they mentioned that was a risk or a potential outcome with the preterm labor. So just with where things are at, to keep baby safe, our best option, I think, is to go
Why
in.
am I
And,
not going to be able to have my baby vaginally?
well, the problem is we've slowed things down, and now you have your fever has come up, and then now with the baby's heart rate dropping, it's just baby would not tolerate. The baby wouldn't survive if we try and do a vaginal delivery because you're not dilated. We've stopped that, so I know.
Yeah, it's a
I know.
C-section.
I'm sorry,
If it's the best
I
thing
know.
for the baby.
but it's what's going to keep baby safe, and you'll be able to get through this. Okay? Do you have any questions?
No.
No? Okay. Someone from the OR team's going to come in, and they're going to get you ready for surgery, and I'll see you back here in just a little bit. Okay? All right. Thanks, you guys.
Hi, my name is Robert. I'm the operating nurse, and I'm here to help you out, get you prepared and ready for the C-section. So it looks like we have some non-reassuring fetal heart rate going on, and that's one of the reasons that we're headed to the C-section. Looks like there's also a high-risk pregnancy due to your age and some of your recreational habits.
Told you.
So let's go ahead and talk about, I'm gonna have to put in an IV catheter because there's gonna be some regional anesthesia and you're not gonna feel anything below the waist. So we wanna get that started. When was the last time you ate?
I don't remember.
You ate today. Remember that? McDonald's? Remember I bought you?
Yeah.
Okay, thanks. And then also, it's good that your name is
Jose.
Jose, nice to meet you. And you're the baby's dad? Sweet. So you're here? Okay. So continuing on, let's go ahead and get that catheter started. And
Are you gonna be doing it?
yeah, I can do it for you. Do you guys have any questions?
Is the baby gonna be okay after the surgery? Am I gonna be okay?
Okay, you're gonna be fine. They're gonna stitch you up. We'll get you taken care of. You're not gonna really feel too much because you're gonna have anesthesia. So after about 12 hours, then you'll start feeling pain. And then we'll give you some more pain medication later on.
Oh.
And your baby's gonna be fine. We have a NICU nurse that's awesome, and they're gonna take care of your baby for you.
Okay, so I got an APGAR score of 5. Heart rate is greater than 100. Slow weak cry. Flaccid muscle tone.
Okay.
Reflex irritability. There's a grimace. Pink body but cyanotic hands.
Okay.
So what do you think we should do?
Well, I think we need to call Dr. Dilation, and we need to tell him to come and intubate this kid because he needs a surfactant therapy. We also need a cardiac monitor in order for this baby to monitor the cardiac rhythms. Okay?
Okay, sounds good.
Okay,
We'll
let's go.
I'm going to talk about APGAR scoring and how we give the score to the baby. So APGAR score allows the nurse to rapidly assess extrauterine adaptation and intervene with appropriate nursing actions. So we assess heart rate, respiratory rate, muscle tone, reflex irritability, and color. So we give the baby 0s if there's no heart rate, there's no crying for the respiratory rate, if it's absent, has flaccid muscle tone, has no reflex irritability, and is blue and pale. So that would deserve, those are all 0s. To get a 1, baby's heart rate is less than 100, has a slow weak cry with respiratory rate, has some flexion of extremities, and a grimace with reflex irritability, and has a pink body and cyanotic hands and feet. To receive a 2, which is good, you get a heart rate greater than 100, respiratory, you get a good cry from the baby. Muscle tone is well flexed. We have reflex irritability is a cry, and color is completely pink.
I'm going to talk about thermal regulation as it relates to a preterm baby. So thermal regulation is the balance of heat loss, heat gain, and heat production. And in general, heat travels from higher temperatures to lower temperatures. So especially with preterm babies, they have an increased heat loss by evaporation due to an increased total body water, amounts of body water, and they also have thin skin. Babies in general rely on metabolism of brown adipose tissue for thermal regulation. Some of the ways that you can lose heat is by convection, which is losing temperature from a warm surface to a cooler air current. There's also radiation, which is heat transfer from a warm object to another object that's not in contact. There's also evaporation, which is the loss of heat when water is converted to vapor. And we also have conduction, which is a warm surface to a cold surface by direct contact. So things to keep in mind with the preterm baby is to make sure if the preemie is in the incubator to warm up the incubator to 96.8 to 97.7 degrees Fahrenheit. We also want to make sure the baby has a cap, and we also want to make sure that the baby is wrapped in warm blankets. So what we also want to do is check the baby's temperature to make sure that it's within range. And we also want to continually recheck the baby's temperature per your agency's policy.
Hi, my name's Diana. I'm going to be your nurse, and I'm going to be talking about breastfeeding. Are you planning to breastfeed?
No.
Well, I'm going to give you a little bit of information just to tell you the benefits of breastfeeding. So the breast milk has everything your baby needs to grow and be healthy. It has nutrients, it fights infection with your baby. That's not found in formula milk. It's also better for your baby's stomach, and your baby may have a fever with spitting up and constipation. Breastfeeding children do better in reading, math, and learning testing scores. So you can always start pumping, and then we can take your breast milk down to, or you can take it down to NICU for your baby.
Maybe I'll
Yeah?
consider
Okay.
breastfeeding.
Okay, do you have any other questions?
No.
No.